There's a big difference when it comes to drops, eye drops that is. A lot of people are apparently misusing them, and it's becoming quite the problem. 3.5 million women and about 1.5 million guys suffer from severe dryness in their eyes. While eye drops are a great way to find relief, sometimes though they can do some damage to your eyes if you don't use them correctly. Joining me this morning is Dr. Deepak Raja, Orlando Eye Institute ophthalmologist. Good to see you. Thanks for coming in today. Appreciate it.
Thanks for having me, John.
You know, I didn't realize that many people have this big of a problem. What's the problem with using eye drops on a daily basis, or is there a problem?
It depends on the eye drop. If you're using artificial tears, that's generally pretty benign over the counter, although some brands are certainly better from an ophthalmologist perspective than others. A lot of people concentrate on the symptoms of dry eye, and one of the common ones is redness, unfortunately, which from a cosmetic standpoint can be bothersome for people.
Well, we won't name any names here, but the ones that take the red out, right? You know, those kind of, okay, they're okay sometimes, but what's the problem with using them often?
If you use it frequently, much like anything, the body becomes used to it, and it will not last as long subsequently as it does the first couple of times. So people end up using it more frequently, and it becomes very addictive. I'm more of a fan of treating the cause of a problem than just treating the symptoms. So for that reason, I think there are other medications, prescription or non-prescription, that can be better treatments for treating dry eyes.
So medications, what are some of the other causes? Contact lenses, I've heard, are causing a lot of really dry eye situations.
Absolutely. Contact lenses can cause a lot of dryness in the eyes because at the end of the day, it's a foreign body, which is unnatural for the eye. So it's important to have a good tear lake, so you have a lot of wetness around the eye, so there isn't a lot of chafing.
So outside of the drops, what else can you do?
Omega-3 fatty acids can be helpful, like fish oil.
Omega-3 fatties?
Flaxseed oil. Hormone replacement therapy for the right people can be effective, especially women in their 50s.
Outside of the contact lens issue, I mean, you've seen this number increase in kids who are needing drops. Why do you think it's so prevalent in kids these days? Is there something in our diet that might be causing a problem?
Certainly, dietary changes can be a problem when the fatty acids are now shifting away from omega-3s into omega-6s. That might play a role. I personally feel that a lot of the electronic devices are probably instigating things.
Oh, wow.
How many times have we seen a kid on an iPad in the
right up on their face
table?
Too, right up on the face. So bottom line, if you're having dry eyes, don't use the drops every day, or are there certain ones you can at least get started with?
You can use artificial tears that are in a bottle if you're only using it a couple times a day. If you're using it frequently, preservative-free, that come in a vial are a lot safer. And if you have a persistent problem, see your local eye doctor. It may not be dry eyes, it may be something else, and it's important not to miss that because sometimes time can be of the essence.
All right, Dr. Deepak Raja, thank you. That was good stuff. I do appreciate it. All right.